Buenos días a todos y a todas. Bienvenidos a esta jornada técnica sobre innovación y digitalización en el Sistema Nacional de Salud británico y las posibles oportunidades comerciales para nuestras empresas andaluzas. Soy María Zumárraga, coordinadora de desarrollo de mercado en el Reino Unido e Irlanda, dentro de Andalucía Trade, la Agencia Andaluza para la Transformación y el Desarrollo Económico de la Junta de Andalucía, donde, además de otras muchas competencias, apoyamos el proceso de internacionalización de las empresas radicadas en Andalucía. En breve, mi compañero Felipe Martínez Aret, director de la Oficina de Andalucía Trade en el Reino Unido, nos ofrecerá una introducción de las características generales del país y nos presentará a los ponentes. Antes de ello, recordaros que esta jornada está siendo grabada y que publicaremos el vídeo en nuestra web, aunque os enviaremos el enlace a la grabación en unos días. Os animamos a participar activamente a través del chat, donde podéis escribir vuestras preguntas, vuestras dudas, comentarios, todo lo que queráis compartir con los ponentes o con el resto de los asistentes. Y sin más, cedo la palabra a Felipe Martínez. Muchas gracias.
Muchas gracias, María. Bien, pues a continuación vamos a hacer una introducción muy sucinta respecto a la situación actual del país y sin otra pretensión que la de enmarcar un poco el contexto espacial y económico del sector que vamos a abordar y que es objeto de este webinario. Comenzaremos por señalar que es la segunda economía de mayor tamaño de Europa, solo por detrás de Alemania, y la sexta de todo el mundo. Está dotada de un alto nivel de dinamismo, de robustez, resiliencia y de un alto grado de apertura al exterior. Es altamente dependiente de su sector exterior, a la vez que es muy atractiva para el capital extranjero y particularmente dentro de algunos ámbitos. Es un país con una superficie total relativamente pequeña, es algo menos de la mitad de España, para que nos hagamos una idea, pero está muy densamente poblado. Desde luego, la densidad de población es muy superior a la que podemos tener en España. Esta alta densidad demográfica alcanza sus cotas más elevadas en el cuadrante sureste del país, en la zona de Londres y sus alrededores, donde se concentra alrededor de un tercio de la población total del país. La población total que existe, que habita a día de hoy en Reino Unido, ya se cree que ha superado la barrera de 9 millones de personas en el año 2025. Si bien este crecimiento tan importante que se había observado en épocas anteriores ha tendido a ralentizarse en los últimos años. Como señalaba, otro rasgo característico de la economía británica es su atractivo para la inversión directa extranjera. Como luego nos explicará Shona con mucho mayor detalle, y muy especialmente en lo que se refiere a los sectores tecnológicos, a la industria farmacéutica, al sector TIC, el aeroespacial o el aeronáutico, por citar algunos ejemplos. El sector servicios explica más de 3/4 partes del PIB británico y dentro del sector servicios tiene un peso muy significativo el sector servicios, considerándolo, pues, tanto lo que consideremos lo que es la banca privada o la banca de inversión como la industria de los seguros. Ello convierte a Londres en una de las principales plazas financieras de todo el mundo. También destacan por su importancia la industria automovilística, las industrias creativas en sus diferentes variantes, gaming, sports, las de alta intensidad tecnológica en sus diferentes modalidades, los sectores conectados con la defensa, el aeronáutico y el aeroespacial, donde también son una potencia a escala global. Otros sectores que también revisten una gran importancia para la economía británica, no solo en términos de su aporte al Producto Interior Bruto Nacional, sino también por el volumen de empleo que ocupan, destacan entre otros el sector TIC, el de los productos químicos, la industria farmacéutica, entre otras muchas. El Brexit también ha tenido un efecto limitado a efectos de la deslocalización del sector servicios, pese a lo que se pronosticaba desde diferentes ámbitos y en sentido contrario. Según el último boletín publicado por el Parlamento británico, el PIB del Reino Unido en el año 2024 habría ascendido a algo menos de 2.900 millones, 2.900 mil millones de libras esterlinas, de los cuales algo más del 79% corresponden a actividades que se enmarcan dentro del sector servicios. En torno a un 13,5% correspondería al sector secundario y algo más de un 6% a la construcción y un 0,7% al sector primario, la agricultura y sectores afines. A pesar del escaso peso del sector primario, es extraordinariamente dinámico y productivo al ser capaz de producir alimentos equivalentes al 60% de las necesidades de su mercado interno. Esto nos da una idea un poco de la alta productividad que se puede identificar en este ámbito. Tan solo emplea un 1% de la población activa, según los datos que publica el Banco Mundial, pero sin embargo las tasas de productividad son muy elevadas, como venía diciendo anteriormente. No obstante, han de recurrir a los mercados de importación para completar la oferta de alimentos disponibles y que por motivos obvios no pueden ser cultivados dentro del país. También retiene una importancia destacable la cabaña ganadera, tanto bovina como ovina, y también es un país con un sector pesquero tradicional con una cierta relevancia y muy conectada con lo que es las comunidades locales. A efectos del sector secundario destacan las industrias aeroespaciales, farmacéuticas, defensa y también el país cuenta con una importante reserva de recursos minerales. Así, según British Petroleum, el Reino Unido sigue figurando entre los líderes mundiales de la industria petrolera. El sector industrial emplea en torno al 18% de la población activa y, sin embargo, su aporte al Producto Interior Bruto está tan solo algo por encima del 16%. Destaca la fabricación de maquinaria diversa, equipos de transporte y productos químicos. Los sectores más dinámicos y que muestran un mayor vigor en términos económicos son el sector TIC, la biotecnología, pero también las energías renovables e incluso el sector de la defensa, como mencionaba anteriormente. En 2022, el valor total de las ventas de productos de lo que es el output británico ascendió a algo más de 429.000 millones de libras esterlinas y lo que supone un crecimiento de un 7% con respecto al año inmediatamente anterior. La fabricación de alimentos siguió siendo la mayor división y representó un 21% del total. En el periodo comprendido entre julio y septiembre de 2023, el sector manufacturero representó algo menos del 10% del output total del país. El sector terciario, en cambio, constituye un poco el núcleo duro y la piedra angular sobre la que se asienta la economía británica, aportando casi un 80% del Producto Interior Bruto y empleando a un 82% de su mano de obra disponible. Su sector financiero tiene una dimensión muy grande y es sede de las empresas de mayor tamaño de la industria a escala planetaria. En 2023 aportó en términos absolutos algo más de 208.300 millones de libras esterlinas, o lo que es lo mismo, algo menos de un 9% si evaluamos las variables en términos relativos. El sector turístico tiene también importancia, es alrededor de un 9,5% del Producto Interior Bruto, y en tanto sector económico generó más de 237.000 millones de libras en el año 2023, que es el último año para el que tenemos datos disponibles. En cuanto al Producto Interior Bruto, al PIB per cápita, está justo por debajo de los 50.000 dólares americanos, según datos del Banco Mundial, y hay que señalar que la distribución de la renta es poco uniforme a lo largo del país. La región sureste del país, la que tiene los niveles de renta más altos, Londres y su zona metropolitana y los condados circundantes, pero también pese a ello el Reino Unido mantiene una renta por habitante relativamente alta dentro de lo que es el contexto europeo, si lo comparamos con la media de otros países del entorno, aunque está claramente por debajo de otras economías de un tamaño muy inferior, como puede ser Irlanda. El nivel de desarrollo socioeconómico presenta notables divergencias también a lo largo y ancho del país. Y respecto a la situación económica actual, al margen de lo que exista dentro del contexto de la situación del entorno político, la inflación se situó, según el último dato que corresponde a octubre de 2025, la inflación, el CPI o el IPC, según la denominación española, fue del 3,6%. Aún así, aunque mantiene una tendencia a la baja, sí está lejos del objetivo de inflación del gobierno y del Banco de Inglaterra. Estamos, por tanto, en un contexto de inflación moderadamente alta y el gobierno está aplicando políticas monetarias que pretenden mantener el valor de la divisa también para intentar controlar a la medida de lo posible el crecimiento de los precios. El tipo de interés del Banco de Inglaterra está actualmente en el 4%. Se han producido sucesivos recortes en esta variable y se espera que siga una senda descendente en la medida que la inflación vaya siendo controlada. En la próxima reunión del Banco de Inglaterra, prevista para mediados de este mes, se espera que haya una bajada de tipos, aunque bueno, pues puede pasar cualquier cosa, ¿no? La tasa de paro se sitúa actualmente en el entorno del 5%, lo que supone un ligero repunte con respecto a los datos de los periodos inmediatamente anteriores, pero lo que sí parece evidente es que mantiene tasas de desempleo muy bajas de manera persistente y, y es una tónica, digamos, que se ha mantenido así a lo largo de- del tiempo, ¿no? El déficit y la deuda pública netas están en torno al 4 y el 96,4%, son datos que corresponden a agosto de 2025, lo que supone también una caída con respecto al dato de 2024. En lo que se refiere al comportamiento de otras macromagnitudes, según los datos publicados por la oficina de la ONS, la Oficina de Financial Statistics, esta estima que el PIB británico creció un 0,1% en el tercer trimestre del año en curso y en comparación con el trimestre inmediatamente anterior de este mismo año, de 2025. En el segundo trimestre del año actual, el Producto Interior Bruto creció en términos nominales un 0,3% frente al 0,7% que había hecho en el primer trimestre. En términos interanuales, el crecimiento del Producto Interior Bruto a la altura del tercer trimestre fue de un 1,3% y gran parte de este crecimiento se explica por el buen comportamiento del sector servicios. Bien, esta sería esta parte introductoria y tras ella voy a dar paso a Shona Brown, quien ha tenido la amabilidad y la deferencia de apoyarnos en este evento y con quien hemos colaborado también en otras muchas iniciativas y que será quien realice la primera intervención de las dos previstas para la jornada de hoy. Shona hará referencia específicamente al NHS 10 NHS 10-Year Plan, nos apartará datos generales sobre el proceso de digitalización de la entidad y también de las ventajas que aporta a las empresas foráneas el hecho de localizarse en el Reino Unido, pudiéndose así beneficiar de los fondos y apoyos de diferente índole previstos por el gobierno británico para este fin. La segunda de las ponentes se refiere ya más extensamente a aspectos relacionados con la estrategia, la importancia de la innovación y las dinámicas que rigen actualmente el funcionamiento del NHS. Pues bien, Shona Brown comenzó su carrera en el equipo comercial de la Embajada Británica en Madrid en el año 2005. Desde el año 2012 ha estado trabajando en el sector de las ciencias de la vida, liderando numerosos proyectos relacionados con la salud. Su trabajo implica colaborar con una amplia variedad de partes interesadas, tanto en España como en el Reino Unido, incluyendo el gobierno, la industria, ciencia y el sector sanitario. Shona apoya a las empresas británicas en en la expansión de sus negocios en España, así como a las empresas españolas que desean crecer también en el Reino Unido. Shona fue educada en Escocia y habla con fluidez español, alemán e inglés. Ella nos hará la presentación creo que en inglés, pero creo que combinará ambos idiomas. Y por último, señalar que antes de trabajar en la Embajada de España, trabajó previamente en el sector privado. Es cuando quieras, Shona.
Pues muchísimas gracias. Empiezo en español, pero luego me voy a cambiar a inglés. Primero, Felipe, yo creo que sabes más sobre el Reino Unido que yo. Y has dado tanta información sobre el país. Pues nada, pues good morning, everybody. I am Shona Brown and I work in the British Embassy in Madrid. I work for the Department for Business and Trade, which is the UK government department which supports British companies export overseas and to help foreign companies who are interested in growing in the UK with a physical presence find their way. We have a very vast network of contacts and a lot of support that we can offer. As Felipe said, I have worked in this sector for a number of years, helping lots of different companies from across the life sciences sector, but focusing predominantly on medtech, digital health, AI, all really services and products which would go into the NHS, I would say. So as a little bit of background, I think it's important just to briefly touch on the importance of this sector for the United Kingdom. So a few months ago, the UK government launched its life sciences sector plan with a very ambitious vision to make the UK a global leader in life sciences innovation. The UK has a lot to offer. We have got top universities, very strong R&D centres. We have a very large National Health Service, which is really very similar to the Spanish Health Service, as in that it's free at the point of care. The gatekeeper is the GP, so the general practitioner, and then the specialists are at the hospital. We have very similar challenges, and the system probably needs to change for it to become more efficient and to deal with the problems and challenges it has to deal with nowadays. So I think it's also, I'm just going to touch on a few things because Maria is going to go into everything in more detail, and I don't want to steal her thunder, and she knows much more about this than me. But I think it's important for the purposes of this webinar as well to talk briefly about the NHS 10-year plan, which is titled Fit for the Future, because here it recognises some really fundamental changes which will potentially create opportunities for companies both in the UK and for foreign companies as well. There will be a large amount of money invested in new technologies and innovations because we need to make changes in order for the NHS system to function and to care for its patients. I would like just to very briefly mention as well the structure of the NHS. So as you will, I'm sure, be aware, the UK is made up of England, Scotland, Northern Ireland and Wales. They all have their own NHS, for example, NHS Scotland, NHS England, but they do work together. There are objectives together, biomarkers are agreed, vaccines are agreed. There's a lot of agreement between the different sectors, but the budget sits with the regions very similar to the way it is here in Spain. I also just wanted to flag up some organizations which I think could be useful for you. I'm very happy to share my slides afterwards. These are active links. Maria will also go into more detail later about the importance of regulatory and assessment evaluation. And we also have a number of industry associations which are very active, which may be useful for you to connect with too. Also, from a point of view of events in the sector, I cannot say I have been to all the events on this list. I don't know, maybe Maria, you've been to more of them than I have. But I can absolutely highlight the NHS Confed Expo as a very good event to learn more about the NHS, the trends, speak to stakeholders. The HET Show and the DigiFest as well are very good ones. So really, if you are interested in expanding your business in the UK and you think it would be useful to potentially explore setting up an office, you can find more information on this particular link. What the embassy cannot do is look for distributors, commercial partners, but we can help make connections and signpost. So I would encourage you to get in touch with us. I will put my email in the chat, and also that of my colleague Alejandra Cortes, who is listening today. We work closely together. I do speak Spanish, and of course Alejandra does. So I would encourage you to get in touch. And with no further ado, I think, I don't know, it's back to you, Felipe, or we're going straight to Maria?
Yeah, it's back to me.
Thank you.
Thank you very much, Fiona, for your presentation. Now, I'm going to introduce you to the audience, the second presenter of today's webinar. Thank you very much, Maria, for being with us today. And of course, we greatly appreciate your support in putting together this webinar. Maria Rupsova is a Health Innovation Project Manager with an international focus, Health Innovation Yorkshire and Hamba, part of the National Health Innovation Network. She leads key programs supporting UK and global health tech innovators entering the NHS, including the Propel Health Tech Accelerator and multiple international boot camps. Maria works closely with NHS, ICB, academic and commercial partners to guide companies on market entry, evidence requirements and adoption pathways. With a strong background in business and innovation, she brings extensive experience supporting earlier stage companies and building cross-border innovation collaborations. It's over to you, Maria.
Hello, everybody. Thank you so much for inviting me on this webinar. It's really, really exciting. I'm absolutely happy to share my slides. And I hope that all part before was really interesting because no clue at all in Spanish. I'm so sorry. Okay, I hope now it will be a show. And
we can see it, Maria.
Great, thank you so much. And again, thank you so much for this event. It's really, really nice to be here. And will be talking about the NHS structure, the programs and other things there. And please do shout your questions or afterwards. I hope we will have like 10 minutes left and you can ask me a question if you have, or if you will have on future something, please, again, I'm happy to share with my email and you can just message me and absolutely no worries, happy to help and answer for all your questions. And yes, thank you so much. We start with basic things. I think it's about NHS and how it's important for us to have innovators in England from overseas. And we're really keen on this because we know them. In the world, we have a lot of people who knows more, who can bring something new innovations here in UK, and we're really, really open on this. And in general, the UK medtech market is the big market with the investments. And in a slide, you can see all the numbers. I don't want to just repeat this all, but you just need to understand the UK and in general, NHS England open for new innovators. And we have a lot of investors who are happy to bring the money to develop innovators, to help to fix sometimes NHS and to add more nice things to our region, particularly about the structure. How Shona mentioned before, it's we have in a different parts of NHS in a different areas, but particularly NHS England, the biggest one, and we have the around 42 integrated care board, and this is a main thing. And then we have hospitals, we have a primary care, secondary care, third care, where we have a primary care in the GP, where you just the patients come over and ask. The secondary care, it's about the the secondary care, it's about the hospitals, and it's a bigger trust. And third care, it's a mental health and another things. We less focus on the private, more, of course, it's NHS England, it's national, and we just you need to understand about NHS. We call this a beast, truly, because the structure really big and massive, and you need to understand, if you want to enter NHS, like your primary market, you need to understand how it's built and see where your department, how it's working, all this stuff. And we, again, are happy to help with that. It's particularly if we talk about the spread and adoption. The main things, what you need to do, what you need to understand, is the needs and strategy, what the NHS need now, and how Shona mentioned, we have a 10 years plan, Fit for Future, and where we talk about the main things, it's 3 shifts of this plan, and I will talk a little bit later about that. And but the particular, each area in a country or trust or hospital, they focus on some different areas, like some universities and hospitals, they really keen on children healthcare, someone more work with obesity, someone work at the different priorities in different areas. And our job, Health Innovation Yorkshire and Humber, not just like Health Innovation Network in general, is to help innovators to understand where their client, where their first contact, which help to develop and know more about your area expertise, and we're happy to help with that and direct you. The second thing's important at system readiness, it's your innovation. Like sometimes we see a lot of people who have a just idea, and it's great, no worries with that at all. But to enter NHS market, you need to have your system in place and test it, and it's need to be ready. And it's great when you have an idea and decide to start to think about market, to build this idea in a way to feed the NHS. It's absolutely brilliant to do this all. But if you already have the something in a place, you already build your innovations, your product, just it's need to be fully ready to launch in a NHS. The third really important thing is the culture, leadership, and the people. It's a tricky part for the companies overseas, because not everybody understand how British culture works. Sometimes when you talk with the hospitals, when you talk with the doctors, and it's really important, because I'm Ukrainian, and I learned this for last 4 years, how the culture really important in a business relationship. And again, it's thing where we can help. And a local context. What I mentioned before, each hospitals, each trust, each areas have their own priorities, and you need to understand these priorities and bring your idea or your product in where there's need, and it's and how it's work. And important things, it's about funding. Sometimes we see a lot of great ideas, but the people understand how, like innovators understand how they can enter NHS market, how they can work and other things, but they can't see where the money from, who will pay for that. And the funding, it's critical for that, to build your business case, to build your understanding this, because a lot of people can a lot of innovations, they're great for NHS, but it's not the area where the NHS happy to pay for that. That's why it's really critical to understand this all. The next slide, it's tricky, I won't say, it's the pathway. And I'm happy to share these slides afterwards, but this slide, it's really, really great because it shows the 5 different stages and how you can develop your innovation through each stage and what you need to have. If we talk about the first idea assets, it's about the particular idea, your IP, your basic description to understand the how it's worked. You need to have feedback from experts, and this is first idea. The second step is development particular, and in development you need to do the value proposition, and we will talk little bit about that, and the prototype. And of course in NHS it's really important, and everybody will be asking you about sustainability. And when you develop this all, you need to understand how it's work, and if you will grow, how it will be work. Particularly in this stage, you already need to think about that. The second is evaluation. It's real world evaluations, it's health economics, and it's all about the regulations. Important things to mention about regulations, and I want to little bit talk about that. The different regulation with EU, with UK, and if you have your regulation in place in Spain, it can't be the same. You need to do the from scratch, I won't say, in UK. Yes, you can bring your data, you can bring your product, and it can be a little bit faster, but still you need to do in the UK, like if we talk about CE mark, it can be just transfer. Unfortunately, we work on this in general in our strategy to just build the easiest way, but still it's now in a place, and you need to do this all in the UK. And what the Shona mentioned about before, the list of the companies who can help you, it's not a company, it's regulatory, MHRI, who work with medical devices, and you can go on their website and see the different devices, how they classified. Or it's an IHR, sorry, so many abbreviation. NHS, truly NHS built on abbreviation. I'm sorry for that. But again, you will have afterwards all this information, and it will be much more easy for you to go through this all. And yeah, we have research departments. We have different parties who can help in each this part. But regulation, when you have an idea or you want to enter NHS market, it's first things what you need to do and check its regulation, how it works for you, for your innovation, and what you need for that, or something else. The second thing, not second, it will be already a fourth step, it's a commercialization. It's about the business case, it's about market assets and procurement. The way to enter NHS market, you have a different path, and again, what you have, and it's not the easy straightaway way. You just need to know this or ask who can help you with. And if we talk about particular procurement, it's called supply chain. NHS have a supply chain where you submit all your innovation, put in a place all regulation, everything what you have, evidence, and this is list what you need to have. And then you in a supply chain, then each trust can just build the procurement, and you can bid for some product or service. And to do this, it's the next step to sell for NHS. You need to be in supply chain, and you need to go through procurement. Sometimes it's another ways, more easiest ways, if you have AI unique idea or something like that, then you can go in a little bit different way. And but still, it's yeah, you just need to a little bit have more information in each stage. And we, from our side, and we have a lot of agency around who can help you with that. And the last things is the spread and adoption. It's about the scale-ups. And this is another thing. Now, NHS England, they introduced the innovator passport. When you already in one trust, you sell your product or service, and it's already there, and the NHS in one area use this, and then you want to spread in a different trust or in a different, in the primary care, maybe it's PCN or in other areas. You have like this passport where the all documentation there, and then you can spread easily for each region. But because it was introduced by NHS like in the summer, it's fairly new thing. And now the spread and adoption is going a different little bit way. You still need to be in supply chain, and then it will be procurement in a different trust, and you can bid for this, like the same scheme, I won't say, but still it's you need to have these connections. And from our side, we're happy to do this for an introduction to see how it works. And when you have somewhere your product already evaluate, already have nice reviews, I won't say, it's easy to do the next steps to spreading your product or service. But again, in the system, you just need to understand how it's work and then just go the steps. Here, I want to talk about a little bit about real world evaluation. What is that? And you need that. It's really important, but it's already this slide. And next one is the deep knowledge about the steps. I don't know how it's relevant for everybody, but I'm happy just go through this slide. And real world evaluation, it's about the costs and benefits, where you can show your benefits about your innovation, because it's really important how many money can save your innovation, or how it will be, what the benefits there, and just mark this all and put it in a report, because this is what each trust or each the procurement organization will ask you to show this, because they need to see the obvious evidence, like, yes, it's worked for us, it's great, and we want this and you want to use this. That's why it's really important things to do. And another thing is the business case. The business case, it's more about cost effectives, and you just need to write down the clear things to show your particular innovations, its work for NHS in a business way, because yes, we're really keen on help the patients and doctors with the workforce, maybe or different areas, and bring the something new ways to work. But still, we need to understand that in the end of the day, it's about who will pay for that, and how much and how many money in the trust, and they're happy to spend this money or not. That's why the business case is critical thing to do this and account this all and show the trust. It's really not just helpful for area where you work for discipline, but it's great for value for money as well, for trust or for primary care for GP. And here I just want to show the little bit the mindset, what you need to have to enter NHS market. What we talk about, the three main shifts of the NHS now, it's moving from hospitals to community. The NHS now want to work with more community services with the primary care and the less send people to hospitals. And it's good shift, and you need to understand if your innovation align on these three idea. It means more chance they're happy to pay for this and use your innovation. The second one, it's making better use for technology, or different words from manual to digital, because sometimes, you know, now we have everywhere in our life that it's smartphones and AI, and it's all digital era. But unfortunately, sometimes in NHS, it's still paper, and we want to just move this all from paper to digital, and for system, what will be benefit the patient and all the healthcare staff as well, and focus on prevention. And it's a big thing, because we have so many studies, and we understand if we prevent, it's will be much more easy and great, not just for NHS, for whole society and country. And this and other things what we look for in prevention. And if you have some ideas on this, it's great. And this circle is really important as well. Think about the pathways. I'm happy to explain about a little bit of pathways. That we have, like, everywhere. We have the pathways, how to treat some type of diseases and another things, and how is work all together, the guidance from NICE. And when you have an idea, you need to think not just about idea, not just your innovation, but how it fit in already built and right pathway where you are, how it's work. And if you want to change way to treat some diseases, you need to understand that, how you will do that, and the next steps. If you want to help or force in a good way, there's some pathways. Just to need to think in this way. The second, it's development and informed, like game plan to understand again how it's work, the systems. The third is the build the consent, stimulate the different demand for just supply. Just this whole circle. Again, when I share this, so you can go through more details and to understand how you need to think with your innovation through this all, not just I have an idea, but how it will fit in NHS. I hope it's helpful, because in the next slides, I will go through particular the Health Innovation Network, how we work and all this stuff. Yeah, questions after that. Yeah, Health Innovation Network. How should I mention? Yes, it's 15 companies in all England, where we help innovators and NHS in both way. We're like in a bridge who understand the NHS needs, because NHS, every time we have a lot of meetings with them, and they know they can ask us to do some evaluations or find some ideas for them. And in another another side of the bridge, it's about innovators who come to us and ask what the better to them, how they can enter market and ask for help. And important thing, we funded by Life Science, Office of Life Science, and NHS England. And they particular we built this structure to help innovators. Yeah, just want to talk about particular our region. Like in each region, we have our health innovators. Particular mine, it's Yorkshire and Humber, and we're one of the biggest region in Health Innovation Network. It's the greatest place where you can lend in with your innovation, because the big region, we have 5.7 million citizens. We have 3 integrate ICBs, and we have a lot of it. Again, there are so many numbers here. We have absolutely nice, diverse population, and really great ecosystem for lending, particular lending innovation. About the Leeds region, we have 27 NHS organizations, include NHS England, to help to work with the innovators. And this is a really great place. We want to say it's the center of health tech innovations. It's Leeds, because we have so great a range of universities, hospitals, and different departments who support innovators. When you innovator, you need to have a support, not just like from our organization, but from ecosystem as well, because a lot of hospitals, they're not quite happy to try something new because they really busy and there's no new way to do some stuff if they're disturbing, less efficient. But particularly in Leeds, particularly in our region, we have this sort of people who happy try new things, who happy help, who understand the steps. That's why we're really keen to have innovators, particularly in our region. And it's great for business as well, because West Yorkshire Combined Authority, it's like the government who support this region. They really are keen on innovations, and particularly in health tech. And they have their own nice business support agencies, support offers for companies who want to land here. And if someone interested, please message me and I'm happy to share with that. This is particular what we offering, like the Health Innovation Network have a main 3 shifts of support. And I want to mention it absolutely for free, and you can just message us, fill the form in the website, and we're happy to do some stuff and help you with all this. The first universal support, it's the we called it triage and help. Like we, in my team, it's more than 8-9 people who work with the innovators from different countries and areas. We just talk with the innovators, understand what they do, understand how they can feed NHS, signpost you with funding opportunities, with some important people, just introduce for some areas, and guide you with this pathway, what I showed before, like with the steps, what you need, where you can get it, like go with you step by step. The second, in haste help, it's about more to support with apply for funding, research and evaluation, to help you budgeting, health economics, just all this particular in-depth help. And the third one is distinctive. If already, when you establish your company, you understand what you do, you go through all the steps, and it's the biggest when you're happy to adopt and happy to spread your innovation in a NHS, we can help you with that as well. Like these 3 big shifts, and some part like universal, it's absolutely for free, easier. Yes, another part we can discuss and do like match funding together to help you to produce particular, maybe a health evaluation. We can do this together and help you with that. But it's the more deeper thing what we can help you with. But the biggest thing for me, because it's my thing, I really like this, at the boot camps, what the Shona mentioned before. How you understand through this whole presentation, I talk a lot about the regulations, about the again, health economics, some stuff what you maybe never heard of. And it's really tricky to understand what particular there, how it's work. And the answer for main question, is the NHS your market in general? That's why we know a lot of information there. It's tricky to understand. And yes, we can help you, like consultate you, but still it's great to do like a boot camp. And we already did this for 7 times. We have a boot camps. It's 1 week here in UK in Leeds. It's the program. It's a 12 master classes from experts in the field. And then in the one-to-one meetings with your particular person from clinic area, like it can be, from different clinical areas. And it's a great way to spend your week and go through each step to understand what you need to do with your innovation, how it's work, and to answer the bigger question. It's a great opportunity for each innovator to understand deeper NHS market. And just want to show you about how many we did the US boot camp 3 times, like it will be 3rd time in January with the Nordic countries, twice with India delegation, and 3 times with Canada. And I want to say it's really great way to understand NHS, to answer the questions, to deeper dive in all this regulation, all this the general answer for question. And we have a great, really nice companies who landed here, who already enter NHS market and have a great business cases and continue to work. I think I have one slide. Yes, it's just one off, I won't say. It's GG Debit, it's the app for patients and families who experience the diabetes type 1. And it's a really great example because they start from scratch and they landed here in the UK, and now they have like full coverage. And it's the software, it's the app, and it's for patients. And now they have a lot of clients. They work with the ICBs across the country, and they have really, really great how I mentioned before, business case. And we have so many companies with like these examples, like from Nordics, we have 4 or 5 companies from last previous Propel program bootcamp who landed here as well and develop more great solutions and particular fit for NHS now and work with them. It's just a great opportunity to spend a week here in UK and answer for questions. Yes, I think I repeat myself a little bit. It's pretty much everything what I want to talk. If you have some question, please happy to answer on this.
Thank you very much, Maria. Para aquellas personas que en estos minutos finales, nos quedan 5 minutos del webinario, si alguien desea hacer alguna pregunta, pues es el momento de hacerlo, y lo puede hacer pues a través del chat y yo se la traslado a cualquiera de las ponentes. Juan Alcalá dice, is asking if do you know how the construction and retrofits of healthcare buildings are done? I understand there are MEP consultants prescribing a system in a tender and commissioners or contractors who purchase and execute works.
Yes, I just want to, it's a tricky question because it's a tender. Yes, you're right. It's go through tender, and I think I need to dig more information because I know that few contracts, like NHS, procure this this particular construction way. and they have bigger companies to do everything. They not procure. It's not in a tender each tiny thing. So it's like a bigger procurement. They give all the works for one big company, and then this company can use another tiny one's companies, like in a work with a white label, because yeah, it's something working this way. But I can ask more deeper because I'm more in a clinician area, not in a construction thing. Sorry.
Excellent. Any
I
further questions?
Can I just,
Sorry.
I guess that is an interesting question just now because of the new community healthcare centres that are going to be built as well. I will see if I can find out any further information as well. We know that there are a number of large Spanish construction companies active in the UK. They're there already, and they are, I'm sure, working in these larger tenders. They might look for subcontractors, I guess, as well. But we can try and find out some more, Maria, you and me together.
Great.
Thank you.
Excellent. So there's another question in regards to global data policy. The apps deployed within the NHS are mandatory using data centers in the UK, and are the requirements private or public based cloud?
Yes, it's the regulation with GDPR. Your sets and all data need to be based in UK, and you have a specific connections. And the few companies in UK, if I remember, it's 5 or 6. The company who can provide you with all this right connections, but they all in the UK, and you need to use all UK not data sets, but it's need to be in the UK. It's mandatory. I hope I answer on your question.
Any further questions?
Yes, please. Yes, please. Just send me a mail with the questions. I'm absolutely happy to help.
Great. So if there are further questions, we're running out of time. So vamos a ir despidiendo el webinario de hoy. Tan solo nos restaría agradecerles a todos los asistentes su asistencia y la participación en esta actividad. Recordarles de nuevo que todas las presentaciones ofrecidas, así como la grabación de esta sesión, están disponibles en breve para todas las personas que deseen recibirlas. Y simplemente han de ponerse en contacto con nosotros por email enviando su petición al buzón general de la oficina, que es reinounido@andaluciatrade.es. Y antes de irnos, también me gustaría reiterar nuestro agradecimiento a tanto a Shona como a María. Thank you very much, you both, for supporting us, for all the information you gave us, and también por el tiempo dedicado to put together this session. Ya por mi parte, muy poco más que añadir. Me despido aquí en nombre de todas las personas que conformamos el equipo de trabajo de TRADE, y por supuesto quedamos a su disposición para todo aquello en que podamos serles de utilidad.
Yo solamente añadir que os enviaremos las presentaciones y el enlace a la grabación sin necesidad de solicitarlo. Estamos a vuestra disposición para lo que necesitéis, y también agradecer tanto a la Embajada Británica en España, que tanto colabora con nosotros, como a María, la colaboración. Thank you so much, Shona and Maria. Has been really interesting and hopefully very useful for the companies. Y gracias a todos vosotros por vuestra asistencia. Hasta la
Thank you so
próxima.
much.
Thank you.
Thank you. Thank you.
Thank you. Bye-bye now.